What if getting sick didn't mean worrying about bankruptcy? What if losing your job didn't automatically put your healthcare, income, and future at risk? For millions of people, where you live matters just as much as how healthy or hardworking you are. In the modern world, no comparison exposes that reality more clearly than the United States versus Europe when it comes to healthcare and social benefits. In the US, healthcare is often tied to your job, your insurance plan, and your ability to pay. In much of Europe, it's treated as a basic public service, something you're covered for simply by existing within the system. One model prioritizes choice, competition, and innovation. The other prioritizes security, universal access, and long-term social stability. Both sides claim their system is better. Both point to real successes. And both come with real trade-offs that affect everyday life in ways most people don't fully understand. Today, we're cutting through the political talking points and internet myths to compare what Americans and Europeans actually get, from doctor visits and hospital care to unemployment benefits, parental leave, and long-term social support. Before we break it all down, take a moment to like the video, subscribe to the channel, and turn on notifications. These deep dive comparisons take time to research, and your support helps keep this content factual, balanced, and free from clickbait. Now, let's start where the difference is felt the fastest and the hardest: healthcare. In the United States, healthcare is largely treated as a market-driven service. Most working-age Americans get their insurance through employers. Others may qualify for government programs like Medicare for those 65 and older, or Medicaid for low-income individuals and families. Some people buy private coverage on their own. But all of this depends on money, employment status, and plan rules, and that leads to why does this happen? It comes down to structure and pricing. In the US, healthcare prices are largely market-driven and loosely regulated. Hospitals, doctors, prescription drugs, medical devices, and administrative costs can vary dramatically from state to state and hospital to hospital. Patients often face high deductibles, surprise bills, and coverage limits that aren't always clear until after treatment. In contrast, most European countries finance healthcare through taxes or compulsory social insurance, which gives governments much greater ability to regulate prices and distribute costs across the entire population. Whether you live in France, Germany, Spain, or the Netherlands, basic medically necessary care is covered for residents, and eligibility isn't tied to employment. This universal approach doesn't mean everything is free. Many systems use co-payments, copays for prescriptions, or modest charges for certain services, but no one in Europe risks financial ruin over a standard medical visit or hospital stay. Another major trade-off is waiting times. Because European systems are publicly financed and cost-regulated, non-urgent procedures can have longer wait times than in the US. This is most noticeable for elective surgeries or specialist appointments. In the US, where prices and provider competition are high, wait times for specialists can be shorter, but at the risk of much higher bills, sometimes costing tens of thousands for even routine care. These systemic differences also shape attitudes towards health overall. Many Europeans view healthcare as a right, funded collectively through taxes and social insurance. Americans, on the other hand, often see healthcare as a personal responsibility, tied to employment, individual coverage choices, and out-of-pocket risk. But healthcare isn't the only place these philosophical differences appear. Social benefits, the safety nets that protect people from poverty, unemployment, disability, and old age. Take unemployment benefits as an example. In the US, standard unemployment insurance payments vary by state but typically replace only a portion of prior wages and may last around 6 months under normal programs. While emergency measures during crises, like the COVID-19 pandemic, have expanded benefits temporarily, the overall structure remains limited compared with European systems. In Europe, unemployment benefits are generally more generous and better tied to prior earnings. For instance, Germany's unemployment insurance typically replaces around 60% of a worker's previous salary for up to a year. In France, benefits can replace up to 75% of previous earnings for up to 2 years in many cases. Europe also has systems like short-time work programs that pay workers to stay employed even during downturns, reducing layoffs and stabilizing incomes, an approach that helped keep unemployment relatively low through recent economic shocks. The differences don't stop at employment. European social safety nets extend to maternity and paternity leave, child allowances, disability support, and housing assistance at levels generally higher than what the US offers at the federal level. While US federal law or FMLA requires unpaid leave for qualifying workers, it does not guarantee paid parental leave. In contrast, many European countries mandate paid leave, often for months, funded through social systems. Social protection spending across the European Union remains among the highest in the world, with many EU countries spending roughly 27% of GDP on social benefits, including healthcare, pensions, unemployment, family support, and disability benefits. Countries like Finland, France, and Austria dedicate more than 30% of their GDP to these safety nets. This extensive social welfare system helps reduce poverty, support families, and stabilize consumer demand, but it comes at the cost of higher taxes. Employers and employees in European count. These systemic differences in social spending tie back into health outcomes and equity. European countries tend to have smaller income inequalities, and their health systems are designed to reduce exposure to financial risk when people get sick. Research shows that Americans overall report worse health outcomes than Europeans at similar levels of wealth. This isn't to say Europe's systems are perfect. Efficiency, wait times, and funding sustainability remain ongoing debates. A stark contrast to the US, where millions still skip treatment because of price even if they have coverage. And the ripple effects go beyond health itself. Access to secure healthcare and social benefits impacts education, employment mobility, family planning, financial risk-taking, entrepreneurship, and even population growth rates over the long term. The American system gives individuals flexibility, innovation, and choice, but at the cost of higher financial risk and inequality. European systems prioritize security, equity, and universal access, but at the cost of higher taxes and sometimes longer waits for certain care. Today, both models face pressure. In the US, rising healthcare costs and gaps in coverage fuel debates over public options, Medicare expansions, and how to balance efficiency with equity. In many European countries, aging populations and economic slowdown strain pension systems and healthcare budgets, forcing difficult choices about future taxation and benefit levels. No system is perfect. Every benefit has a cost. Every policy reflects a set of trade-offs rooted in values about individual freedom, collective responsibility, and how risk should be shared across society. So let me leave you with this question: which model aligns more with your ideals? A system built around individual choice and risk, or one built around universal safety and collective support? Drop your answer in the comments below, and let's discuss.